Patients really want to know their number. If they've had, if you've got a patient, as I said, who comes in with symptoms, who's got maybe slightly poor lung function or a wheezy chest, and then they've got a high FeNO, all of those things are telling you the same thing. And they love that. They love the fact that things line up. And so they come in, a FeNO of 80 or 90, which is fairly typical of an early diagnosed asthma. And you then treat them and it comes right down. They get really excited about seeing that change because guess what? They're feeling better too. So again, the things line up, and that's really great for them. And when you follow them up and do it again, they're really excited about saying, well, what's my number today, doctor? And seeing where that is. So I think that's a really great engagement tool, as well as obviously a practical management tool that we can use in asthma and use the use of inhaled corticosteroids. So the use of FeNO in asthma, I think you use it or you don't, meaning you've got to be consistent with it. And so the education begins at the beginning, as I've mentioned, and explaining inflammation and what that means. And then at follow-up, doing it for the same reasons, to reinforce the messages, reinforce the huge message, which is if you've got asthma with airway inflammation, you need to have inhaled corticosteroids to be taken regularly. So that's really a clear message at the very beginning. And FeNO reinforces that. And clearly, when you're doing follow-up visits, use of FeNO can help you advise and demonstrate in a visual way what's going on then. So, as I've mentioned, someone swears they're taking their treatment and they tell you they're well. I do two things. First of all, you've got a FeNO test, and the FeNO will tell you whether their inflammation is under control. Under control, happy. If it's high, you can then say, well, actually, when you started your treatment, before you started treatment, your FeNO level was 90. It came down to 30 with treatment, and now it's back at 90 again. Why could that be? And then secondly, it really is important to delve into the symptoms, because if someone tells you they're well, if you ask someone with asthma, how are you feeling? They'll say, I'm fine. You can stop there. No, you must not stop there. That's absolutely wrong, because you've got to delve into the individual. Are you coughing? Are you sleeping? Are you using rescue therapy? All those other things. Are you more breathless? All those other things that could be going on. So you'd use the FeNO to then drive a discussion about what could be going on. So, okay, are you really well? Well, yeah. Really? How are you sleeping? Well, I cough. You coughing at night? Yeah, I wake up twice a night. That's so common.
Yes.
And then you go, well, hold on, that's exactly what the FeNO is telling me. And there's reasons for that. So yeah, they said, oh, I feel well, so I've stopped my treatment. Well, maybe that's why you're coughing again and why the FeNO is high. So you can see how that then turns into a discussion, which is positive. And then, and this is the other important thing, we then need to have techniques and ways of treating patients which work with the patient. What I mean by that is, it's no good me just telling you, you've got to take your inhaler. They know that, kind of. We hope they know that, but they're not maybe doing it. So we've got to find a way of using the inhalers that work for them, getting them to use them. Do you see what I mean?
Yes.
So maybe in a slightly more flexible way, rather than you must take this twice a day, otherwise you're going to die, because that's not going to work for people, is it? Or not many anyway. But actually saying to people, well, it's interesting, isn't it? Your level of inflammation's high. Maybe you're not taking your inhaler quite as often as you should be. Tell me, how are you using it? And they'll say, well, I just use it once a day and I sometimes forget. Well, that's okay. But how often are you using your rescue therapy? Well, I'm using that 4 times a day. Okay. How about we then try and combine that approach and say, well, maybe you should be using your preventer therapy much more often, much more regularly, or we also have, you should be aware that we have drug combinations which enable us to take that kind of flexible approach. And FeNO can be a great way into that as well. So really improving adherence.